Good morning, good afternoon, good evening, even good night to everyone joining us from around the world. I'm really delighted to welcome you again to this year's Neuroblastoma Parent Global Symposium. For those of you who've not joined before, you're probably wondering who I am and why I'm talking to you. I'm Daniel Morgenstern. I'm a pediatric oncologist living and working in Toronto, Canada, and actually originally trained in the UK, hence using this accent, which I plan to use throughout the meeting, and kind of try and bring a perspective from both sides of the Atlantic, and have been involved in this meeting over several years and was really delighted to be asked to host again this year. So thank you for joining us from wherever you are around the world. And I just want to hand over straight away to the leads of the two charities that have brought this meeting together, from Solving Kids Cancer in the UK and Solving Kids Cancer in the US, with a message from Gail Jackson and Scott Kennedy. I think we have a video from them to play. Thanks.
Welcome to this year's annual Neuroblastoma Parent Global Symposium 2023. I'm Gail Jackson, CEO of Solving Kids Cancer UK, and I'm delighted to welcome you all again this year and to be able to provide this vital opportunity for parents, caregivers, and anyone affected by neuroblastoma to come together and hear from world-leading experts on the latest data and research. This year featuring topics including immunotherapy, advocacy and research, and CAR T-cell therapies.
Thank you, Gail. And I'm Scott Kennedy, Executive Director of Solving Kids Cancer in the US. This year, we're excited to be able to offer two parallel tracks. Alongside our research track, you'll also be able to access our supportive care track, covering such topics as post-treatment and late effects, grief and loss, and stories of hope.
An event like this involves the work of many dedicated people behind the scenes. We'd both like to thank our hardworking teams across both charities, our symposium host, Dr. Daniel Morgenstern, and of course our generous supporters, Recordati Rare Disease, United Therapeutics, YMABS, Sanofi, US World Meds, and GRC World Forums for providing us with this wonderful platform.
We'd also like to thank our parent facilitators who will be supporting our event today by helping to co-facilitate sessions and leading our new peer support sessions this year. And don't forget, all of the content from across both tracks will be available on demand right after the event.
Thank you for all being here with us. We're delighted you could join us and hope the event leaves you feeling supported, informed, and most of all, full of hope. Thank you.
So thank you very much for those words from the leads of the two charities. If I could just have my slides up, I just want to, in this session, I'm just going to give a brief further introduction to the meeting and how it's going to work. And then I'm going to talk about some highlights of neuroblastoma from this year, just to kind of set the scene for some of the discussions that will be happening later today. So I think I've already given this welcome to everyone. It's really incredible, this meeting, to be able to bring together people from around the world. And I hope through this meeting, you'll find an opportunity to connect with other people involved in neuroblastoma. And I think working in the neuroblastoma field, it's incredible actually how tightly knit the academic community is, that we all know each other from across the world, all working on this difficult disease to try and make progress and make things better. We've already heard about the supporters behind this meeting that have provided crucial financial support to help this to happen. I'm just going to briefly mention them again. Recordati Rare Diseases, YMABS Therapeutics, United Therapeutics, Sanofi, US World Meds, and the kind of tech company running this technology behind the scenes, GRC World Forums. And I think if previous meetings have been anything to go by, that technology really helps this meeting to run smoothly. So thank you to them. Crucially, of course, the participants in the meeting, without whom none of this would be possible. Many thanks to my colleagues from around the world who are going to give their presentations later during the sessions. But I also want to give a shout out to the people working behind the scenes who've helped to put this meeting together, and really to all of you, parents, other people involved in looking after children with neuroblastoma, other family members, because without your involvement in this meeting, it really would be impossible to put together. And I just take this opportunity to say, please try and get as much as you can out of this meeting by asking questions that you have, by trying to find out the things that you really want to know about. I would say it's very difficult for us to ever answer questions about specific treatment for an individual patient. So that's not really something we're going to be able to do in the format of this meeting. But if you have general questions about the topic or other questions about neuroblastoma as a whole, please don't be afraid to answer those. There are no stupid questions. Actually, even what people sometimes think are stupid questions are actually the most probing and difficult questions for us to answer. So I'd encourage you to ask anything that's on your mind. And I also just want to say, and I've said this before, a lot of times when we as the kind of scientists and the academics and the doctors are presenting, it's very easy for us to talk about numbers and generalities and percentage survivals and percentage outcomes. And I just want to take a moment to reflect that I think, this is really ultimately a very personal journey for people going through it and families going through this. And I just want to recognize that and sort of apologize in advance that sometimes some of our language can be a little bit unfeeling in that regard, because when we talk about survival of X%, of course, actually, at the end of the day, we're talking about individual children and what their individual outcomes are. So that is something that I think we recognize and can be difficult to tackle in a scientific presentation. Twin tracks. So you've already heard a mention of this, that this year the meeting is kind of split to provide you with the opportunity to take the route that is most relevant to you. There's a initial session on a kind of landscape overview of neuroblastoma, the current clinical trials that are going on both in North America and in Europe, and a discussion about immunotherapies. And at the same time, this parallel track on psychosocial aspects of coping with cancer, both as a family and the individual issues that can come up. So through the website, you're able to pick and choose which direction you want to go. And of course, if you want to swap from one to the other, then absolutely you're able to do that. An extra thing that's been added into the meeting this time round is this idea of providing some additional peer support for participants. So those of you who are joining this meeting hopefully will have had the option already to sign up for these sessions and have been allocated to different groups so that you get a chance to mix with other families that are going through this really difficult journey and get a chance to chat with other parents and to share experiences. So that is scheduled for later on in the meeting. And I'll just mention that although most of the sessions that are being presented today are recorded, those sessions, of course, are not being recorded. In terms of recordings, obviously with two parallel sessions, it's going to be impossible to listen to two things at the same time, but you don't miss out because all of these sessions are being recorded and will be available on the website after the meeting. And in fact, there's already a kind of treasure trove of meeting presentations from last year, from the year before, that are on there. So if there are topics that you really feel that you wanted to know about and are not part of the agenda this year, there may well be a talk on that from even just last year or the year before on the website. So please do go and have a look at that. So there's a library of previous talks available there for you to have a look at. And then finally, I'm always asked to mention the hashtag. Normally I make a joke about not knowing what a hashtag is, but this year I'm even more confused, to be honest, because I'm not even sure what we have to say you do with it, whether you tweet with it or whether you X with it, or quite what the current verb of choice is. But for those people who are up with this stuff, this is the hashtag NPGS 2023. So for this year, so feel free to kind of share your thoughts about the meeting there. So that is kind of the end of my initial kind of introduction to the practicalities of the meeting. Everything that you need to access the meeting is via the website. You can ask questions through the website. You can change which sessions you're in through the website. And then with the remaining time that I've been allocated and got available, we're going to have an introduction to the whole of neuroblastoma from Dr. Sue Cohen after this talk. So I didn't want to give that, but I thought what I'd do is just kind of give everybody a update on the news headlines in neuroblastoma from 2023. And I've just kind of selected a few highlights of things that have gone on in this last year to really kind of let you know what's been going on in the world of neuroblastoma and to set the scene for some of the things that we can discuss during the meeting today. These are my disclosures. So one of the big highlights of this year for us has been that we had our what is normally twice biennially, so every 2-year meeting of the Advances of Neuroblastoma Research meeting. And this is the chance for all of the physicians, scientists working in neuroblastoma from around the world to come together to discuss the latest research. And of course, with the COVID pandemic that people may still remember, the meeting hadn't actually happened in person for many, many years. So this was a real opportunity for everyone to get together. And there was a lot of fantastic discussion and a lot of presentation of new scientific ideas in terms of treatment opportunities for neuroblastoma. And what I wanted to do was just highlight a couple of things on the more clinical trial side that I think will serve as kind of tidbits of information that will come through for the future. So one of them was the updated data from the European group. So the European group that looks after neuroblastoma is called SciPen. And in the past, patients with neuroblastoma are obviously treated in a different way to they are contemporaneously now. And so what this presentation was about was this particular group of patients who are the babies with neuroblastoma, who normally have a very good outcome. But when they have amplification of this gene called MYC-N that many of you will have heard about, that really changes the biology and the behavior of the tumor to make it much, much more aggressive. And as I've said on this slide, the historical outcomes for those patients, so these are babies with MYC-N amplified aggressive neuroblastoma, were really not very good at all. So only around 30% survival at 2 years. And so one of the developments kind of a few years back was to try and improve the outcome of those patients by treating them more intensively, and in fact treating them on the high risk study that's been running in Europe. And so what was presented at the ANR meeting was the results of treating these patients with more aggressive infant neuroblastoma on the high risk study. And the conclusion was that that more intensive treatment really did dramatically improve the outcome for these patients. And you can see a 5-year, so not even a 2-year, but a 5-year long-term survival, now more than 50%. So still a long way to go, but a lot better than it was. And I think the other crucial information from this presentation was that really these were among the patients that really benefited from the addition of immunotherapy to their treatment. I think everyone on the call will be familiar with us now using anti-GD2 antibody therapy to treat patients with high-risk neuroblastoma to maintain the remission at the end of treatment. And in this analysis, these infants with MYC-N amplified disease really benefited from the addition of dinutuximab beta, and you can see that change in this time event-free survival, so that's the risk of relapse, going from 40% up to nearly 70%, so a significant benefit. One of the other studies that I think many of us were intrigued to hear the results for and came out is the relapse study from the German group. So many people have been using temozolomide and irinotecan in the relapse setting for a long time. And this RIST study is one that we've been waiting for the results on for several years, which is where they took that backbone of temozolomide and irinotecan chemotherapy and then added 2 targeted drugs onto that, one called dasatinib and one called rapamycin. Those drugs have also got different names, which is how you can get to the RIST acronym. And the interesting conclusion of this study was actually adding those extra drugs, that dasatinib and that rapamycin, to the irinotecan and temozolomide did lead to an overall improved outcome compared to the IT chemotherapy on its own. And that especially seems to be the case in patients with MYC-N amplified disease. So these results kind of, I think, are really quite intriguing about maybe we could do more with targeted agents in relapsed neuroblastoma. And I think there's a lot of discussion going on now about how we might think about incorporating those results into our strategies for relapse disease in the future. Then I just want to turn to a few publications that have come out in the last year. So this one was published in Nature Medicine, a bit of a long title, but essentially lorlatinib with or without chemotherapy in ALK-driven relapse refractory neuroblastoma. So many of you will have heard about this gene called ALK, which is pictured here. And essentially what it is a molecule that sits in the membrane of the neuroblastoma cells and signals into the cell for that cell to grow, proliferate, and divide. And several years ago, it was discovered that mutations in this gene, so changes in the DNA structure coding this gene, is one of the most common single gene changes in neuroblastoma, and therefore has represented a really exciting therapeutic target in neuroblastoma. Not in all neuroblastoma cases, it's only around 10% of patients at diagnosis that have this mutation. But for those patients that do have this mutation, either up front or at relapse, maybe we can target that with these ALK inhibitor drugs. And so this study, which was conducted by the NANT consortium in North America, was taking this third generation drug. So we started with crizotinib, then there's been some other ALK inhibitors. This is the sort of latest and greatest ALK inhibitor, and tested it in children with relapse disease, either on its own or in combination with chemotherapy. And these waterfall plots show you individual patient responses, changes in size of the tumor or changes in the MIBG score. So how to read these is that anything that's below the line is the disease improving. Anything above the line is the disease getting worse. And you can see from these charts, there are many, many lines significantly below that horizontal line, showing that the disease got significantly better in response to this drug, this lorlatinib drug, or the lorlatinib drug together with chemotherapy. And so this phase 1 study has really set the scene for the next stage of this, which is to incorporate ALK inhibition into the upfront treatment for patients with high-risk neuroblastoma and an ALK mutation. And so the current Children's Oncology Group study has been amended to change from crizotinib, which we were using before, to lorlatinib, which we think is a better ALK inhibitor. And Europe are also working on incorporating lorlatinib into the upfront high-risk neuroblastoma study as well. So this publication from the phase 1, the first kind of testing of the drug in children, really set the scene for us to be able to add this drug into upfront treatment and to see whether we could use targeted approaches to treat patients from the outset rather than waiting for the position of getting to relapse disease. The next thing I wanted to highlight, the other kind of really groundbreaking paper that came out this year, is this one from the Locatelli group in Rome, and we'll hear a lot more about this later in the meeting. This was a really exciting paper that was published in the New England Journal of Medicine. So a childhood cancer paper getting published in a kind of very high impact general medical journal is a rare event. So clearly something significant going on here. And this was the reports of the responses that the study had shown in patients with relapse or refractory high-risk neuroblastoma receiving GD2 directed CAR T cells. And there's going to be a lot more discussion about CAR T cells later in this meeting, but just briefly to introduce this is the idea that you can take the patient's own T cells, their own immune system, and then in the lab genetically engineer those T cells to put in a new receptor so that you redirect those T cells so that rather than them targeting something A, B, or C, you target them now to specifically attack neuroblastoma cells, and then you can reinfuse them into the patient. And I'm not going to go into all of the details of this because I'm sure it will be discussed later in the meeting, but the exciting thing from this paper was really that there were a large number of patients that really had significant clinical benefit from the anti-GD2 CAR, with some complete responses, some partial responses, really the best overall responses we've seen yet with CAR T cell therapy in neuroblastoma. So I'm sure there'll be a lot more discussion about where this is going next, how we can think about using CAR T cells more in the future. But this paper really kind of opened the door to a lot of excitement about this. The next thing I want to mention is the Neuroblastoma Drug Development Strategy Forum, bit of a long name, but we call it NDDS. And this was the third of these meetings that had happened. And this is a picture of Boston, which is where this meeting was earlier this year. So several of these meetings have been organized before, and they've been designed essentially to bring together the academic community of, again, physicians and scientists working on neuroblastoma to think about what are the molecular, the genetic pathways in neuroblastoma that we're most interested in being able to target in terms of new drugs. Where should we put our effort? Where do we want the energy to go in finding new drugs, in finding new pathways, in testing new things in the clinic? And so for those people that are interested, the write-up from previous meetings have been published, and there's sort of then a list of saying, these we think are the top priorities of the targets that we really want to move forward. And then in this meeting that happened earlier this year, we got together again to kind of really, again, look at what is the lay of the land, what are the current interesting targets out there, and where do we think the effort ought to be going into in developing new treatment approaches. And I'm not going to summarize all of the details of the meeting because there's a lot of information. But what I put on this slide is really just a kind of highlight of the multiple different types of pathways, of ways of approaching neuroblastoma that we discussed. So ALK we've already mentioned, but ALK is also what is just one of many different signaling pathways within the tumor. And you'll see on here things like RAS-MAP kinase, sorry for the typo there, which is another signaling pathway. There's a lot of discussion about that. MYC-N we've already mentioned. MYC-N we know is really critical in neuroblastoma, but has been very, very hard to get a drug specifically against MYC-N. But there are lots of different ways now of targeting the genes that act around MYC-N, and a lot of interest in that. Metabolic pathways, DNA damage repair, ATRX, telomere lengthening, anti-apoptosis, which means are there drugs that we can use to block the signals that the cells use to survive in response to chemotherapy? And if we can block those signals, maybe we can tip the cancer cells into dying. That's what that word apoptosis means. And then epigenetics, which means changes not just in the genes themselves, but in the structure around the genes that determines whether a particular gene is expressed, is activated or not. Cell cycle, which is to do with how the cell controls whether the cell divides or whether it stays just as one cell. And of course, this really growing area of immunotherapy. I think, you know, this anti-GD2 antibody therapy for neuroblastoma has really opened the floodgates to us being very, very intrigued and interested now into what role immunotherapy has in neuroblastoma. And there's a lot of work going on, both in saying, can we change how we use that anti-GD2 antibody? Can we make it work better by giving it in combination with something else? But also a whole host of other approaches for immunotherapy, things like the CAR T cells that we've just mentioned, or other cellular therapies. A lot of work going on in that. And in relation to that, the sort of flip side to that is, well, how is the tumor going to respond to those immune therapies? How are those cells going to get into the tumor? How is the tumor going to respond? How is it going to protect itself against that immune attack? And that's this whole question of the tumor microenvironment. What are the other cells? What are the other molecules inside the tumor? Not just the tumor cells, but the other kind of bits that they live in that might help the tumor cells to survive attack from antibody or attack from other drugs. So a lot of research going on for that. And then finally, some discussion about vaccines and whether there's an approach that we could use there to try and prevent neuroblastoma from coming back. So this is really just intended to give you a flavor and a kind of sense that there is a lot of work going on and a lot of interest and a lot of possible new strategies for tackling neuroblastoma to come down the line. And then finally, I just want to mention this news, which was the meeting of what's called the ODAC, which is the Oncology Drug Advisory Committee. So this is a advisory committee of the FDA. So this is the Food and Drug Administration in the US. And this was a meeting to discuss the possible approval of DFMO to help treat patients with high-risk neuroblastoma. So I don't want to give a full discussion about neuroblastoma, but about DFMO, but many of you will have heard about this drug. And there's been a lot of interest over the years about whether this drug might have a role in treating neuroblastoma by blocking one of the pathways that we think is important in cancer cells, this thing called the polyamine pathway. And studies have been conducted over several years by the Beat Childhood Cancer Consortium. And then most recently, these data have been presented by a pharma company to the FDA to ask for approval from the FDA to allow the marketing, the selling of DFMO, specifically in the context of trying to reduce the risk of relapse in children with high-risk neuroblastoma who have completed their upfront treatment. And you know, I think there's a lot of interest and debate still within the field about these data. And unfortunately, the bottom line is we're kind of still waiting for the answer from the FDA as to whether or not this drug will be approved. As I say, I'm not going to show all of the data, but this is just some of the data that are publicly available. And this is from the paperwork that was submitted by the company. And these curves are not from a randomized study. These are comparing patients on the study who got DFMO against a control group of patients from a different study who didn't get DFMO. But it is intriguing that it looks like there is a significant improvement in the outcomes for patients who got the DFMO. And so we're just kind of in this odd limbo period now, waiting to see whether the FDA will approve DFMO based on these results or not. And obviously that's then going to have a lot of implications for clinical trials in this world and for standard treatment for patients with high-risk neuroblastoma. So the meeting happened, as it said on that slide, a few weeks ago, and now we're waiting for the final decision from the FDA about where DFMO is going to go to next. So to conclude kind of this whistle-stop tour of the last year, I just really wanted to kind of highlight that there is a lot going on. I think there is really a lot of international collaboration already, and there's ever more international collaboration happening, and a lot of conversations, particularly between the research groups in Europe and North America, and a lot of efforts to think about, are there ways of working more closely together, of even doing joint trials together, really of kind of sharing knowledge and trying to drive things forward as quickly as possible. And it's really remarkable, I think, how tightly connected the neuroblastoma academic community is. Overall, this is a very rare disease, and I think it really helps that the number of people working on it talk very closely together. And we are making a lot of progress, and I think we'll hear more about these in the meeting today, about some of these new developments. But of course, I think we all recognize, working in this field, that there's still a lot more to do. The treatment that we give patients at the moment for high-risk neuroblastoma is incredibly long and toxic, and we know it has significant long-term effects. And we know that unfortunately there are still patients for whom that treatment is not enough to ultimately get control of the disease. So I don't think any of us are unaware that there's still a lot of work to do, but I think there's reason to be optimistic given how much research is going on in this field at the moment. So I'm going to stop talking at that point, because we're just about at the hour, and change over to the main program. And I just want to then say, well, what's happening now? What's happening next? And so this is now your opportunity to essentially decide which route you want to go, which of the parallel tracks you want to move down, and to select either the kind of scientific landscape overview of neuroblastoma clinical trials and immunotherapies, or the alternative track of psychosocial aspects and how to deal with some of those kind of more practical issues of living with a diagnosis of neuroblastoma. Thank you all very much for joining. Thank you to my colleagues who are going to be presenting, and I look forward to talking to everyone at the end of the day to wrap things up. Thank you very much, everyone.